Welcome to this screencast on patient care plans. The objective of this screencast is to look at patient care plans and what they entail. Care plans are marked by Keel Tutor. They are meant to be concise, a word snapshot over a couple of days. The form was actually originally intended to be taken down to the ward and filled in there, using reference sources that you would use on a daily basis, such as your BNF. We're not looking for primary reference sources here. We do want a holistic approach showing overall care of a patient, where you've identified pharmaceutical issues and prioritised the four most urgent and important pharmaceutical issues. We want you to define the treatment outcome, demonstrate improved patient outcome, and produce a monitoring plan. Do remember that there is a word count for the table for the pharmaceutical issues. This is detailed on the form and is 1,000 to 1,200 words. What resources have you got? Well, you can look in the KLE, there's resources there, and you can also speak to us here at Keel. We can give advice on your care plan, and if necessary we can always do feedback for a draft that you submit. So we're looking at 4 pharmaceutical issues. Minimum of one of those has to be related to the module area in which you are studying. They do not have to be all interventions in the traditional sense. They can be on simple things such as compliance, discharge issues, patient education and communication. So for example, when you're looking at a drug chart, patients being prescribed amlodipine, you will automatically look at that drug chart and observations and check that the blood pressure is okay. You may speak to the patient on whether or not they're getting any side effects. If a patient is being prescribed digoxin, you will want to check the heart rate and check that that's okay. If you see that a patient is nil by mouth, you automatically look at that drug chart to make sure that all drugs prescribed are an appropriate route for that patient. Whenever you look at a drug chart, you look and scan it for things that aren't prescribed that should be. So for example, VT prophylaxis, has it been prescribed or not? These are all very simple, everyday, automatic things that you do. You may not even consider them to be interventions, but they are. Remember, patients aren't textbooks. We're not expecting textbook cases. Do look in your handbook for advice on the marking scheme. Remember that 4 issues, 25% of the marks go to each one. If you miss out any issue, you will miss out on 25% of the marks. This is an excerpt from the handbook detailing the marking scheme and what is expected. So all potential pharmaceutical issues have been identified and prioritised. Evaluation of the treatment options, and this needs to be in relation to current evidence. Appropriate treatment selected, desired outcomes, monitoring plan and contribution of care, which as you can see has a sizable number of marks attached to it. Now looking at each of these individually, the treatment options, it's 2 marks per issue. We want you to look at all the options for the issue. So for example, with a patient with type 2 diabetes, you want to look at all of the available options for any patient with type 2 diabetes, not just your patient. And the evidence base needs to be better or more than just trust guidelines. The next section then is the treatment option that you're going to choose. It's 1 mark per issue. And here you pick from your options that you've given in the previous section and you say why the option chosen is the best option for your patient. You need to give justification of why this option is best for your patient, which is evidence-based. The desired outcome is what you want to happen, not necessarily what happened. The monitoring is what is required. Here we want to think such things as blood work, but also side effects, tolerability, clinical effectiveness, and how often it is required. So for example, with your blood pressure, do you want it 4 hourly, daily basis? Do you want to give advice for long-term monitoring, for example in a discharge letter to the GP? With things like blood pressure, you may want to mention specifics such as, does it need to be lying and standing as well? Student contribution, this is 2 marks per issue. What have you done? Consider here who you spoke to. Did you speak to the patient? another healthcare professional, the doctor, the nurses, the OT, physio, the time frame it was done in. What did you actually do? If you don't write down what you've done, we can't give you the marks. Risk of harm, drug interactions. It's not sufficient just to identify them, but you also need to show how you would manage them. So for example, clarithromycin and simvastatin. What would you do? Would you change another antibiotic? Would you hold the statin? You need to ensure that the doses for your patient have not been under or overdosing, that every dose is appropriate for the renal function, and if you're stating that you're going to give a particular drug, you need to be how often. There needs to be guidance on how often it's given. Drug allergies, contraindications, and also you could put a patient at risk from a clinical effectiveness point of view. So for example, if you suggest a ACE inhibitor for a patient who is 90 years of age, whilst yes, the ACE inhibitor is licensed in hypertension, this is not the most clinically effective option for a 90-year-old patient. The evidence base for other options is better. So now we're going to look at a pharmaceutical care plan. Example, COPD, peptic ulcer, TIA, past medical history, a diagnosis of infective exacerbation of COPD. Here you can see that the key pharmaceutical issue is the interaction. However, we've also indicated here what that interaction will put the patient at risk of. The management options, given the common organisms and what we can use to treat those, and then the options given that would be to withhold the atorvastatin or to try another antibiotic. As you can see, this has all been referenced. The selected management option then is stating why they're going to choose this particular option for this particular patient, and this has also been referenced. The desired outcome is the prevention of the interaction, but also thinking further outside the box and thinking that actually the desired outcome is appropriate treatment also of the infection. The monitoring gives the blood work and clinical indicators that we want to be looking at. Here you could also put in how often you would expect these to be monitored. The student's contribution to care states what they've done, spoken to the doctor and what they've recommended. Here you could also expect to see what they've done to actually monitor that patient. And the actual patient outcome is the patient has been safeguarded against an adverse drug reaction and received the best possible option for their management of treatment. The next interaction is something you may not see of as an intervention. The pharmaceutical issue is an ipratropium inhaler and nebulizers prescribed together, and the patient actually coming in on an ipratropium and tiotropium inhaler. Here you can see that all management options have been listed and referenced as well. Included in this is actually speaking to the patient. The selected management option again has been referenced and chosen why they've picked a particular management option. The drug outcome, the desired outcome, is the prevention of side effects and medicines optimization. Again, here in the monitoring, we would expect to see how often you would expect to monitor for inhaler technique or the side effects. It's a comprehensive answer for contribution to care. They spoke to the doctor, the nurses, engaged with the patient, and what assessing they did of side effects. The actual patient outcome, patient was saved from further antimuscarinic side effects, and patient was involved in their care. So in conclusion, the pharmaceutical care plan is a word snapshot of pharmaceutical care. There needs to be 4 issues. It is not meant to be a big beast of a thing. Interventions can be very simple. Thank you for listening.